Hi, this is Kenny from Aiskyra. Today we have a special video if you are an Ontario clinician, such as a doctor, pharmacist, or nurse practitioner. The reason is because we'll be talking about the AI Medication Expert, as well as the Ontario Drug Benefit Provincial Formulary, how the two are integrated, and how our AI has created new opportunities and new capabilities for you to save time so you can spend more time with your patients. So if you're in Ontario practicing, you're probably already very familiar with this website. It's the Ontario e-Formulary Search. The most common usage of this website is to check coverage for a medication. Just to show you, checking the coverage for Spiriva, and you can see that there's the DIN, generic name, brand name, how much the Ministry of Health or Ontario government pays for it, limited use code interchangeability, and other notes. Our AI is also capable of returning the same results. So you can ask it, is Spiriva covered ODB? Before I enter the question in, make sure that if you are practicing in Ontario, that you have updated your province to Ontario. It's the top left corner here. The reason is because as we introduce more formularies across Canada, we want to pull the right formulary for you and where you're practicing. So if it doesn't say Ontario, click Update Information, select Ontario and click Update. So now we're going to search, is Spiriva covered ODB? And you can see that it's pulled the same information. Now here is actually where our AI Medication Expert unlocks new capabilities when you have this information. So we've identified 3 daily practice problems. The first example is the drug is on back order and therefore an alternative is needed. 2, the drug that has been prescribed is not covered by Ontario Drug Benefit, an alternative is needed that's covered. And 3, the first line therapy was unsuccessful or side effects, and a second line therapy is requested, but also the second line therapy needs to be covered by ODB as well. So let's look at the first example. Drug is on back order. Spiriva on back order. Give me 3 alternatives covered ODB. Okay, so the AI has identified 3 alternatives, Tudorza, Seebri, and Incruz, that are covered by ODB and are also within the same therapeutic class as Spiriva, which is a LAMA. In the future, we'll be building additional capability for you to create a faxable template out of this to save you time and paperwork. You would simply fill in the prescriber information, the patient information, and send it off to the prescriber to be reviewed and approved. Now let's look at the second example of Dymista. So let's say a prescriber has written that medication and the patient is only on Ontario Drug Benefit, and obviously it's not going to be covered. So what are the alternatives that you can look into? So I'm writing Dymista, not covered. Give me 3 alternatives covered ODB. So Dymista is a little bit of a unique medication because it's an antihistamine nasal spray, and therefore there is not another antihistamine nasal spray that is covered. So the AI looks for other therapeutic alternatives. In this situation, we're talking about intranasal corticosteroids. So it's recommended Flonase, Nasonex, and Nasacort. And also in the future, as I mentioned with Spiriva, in the future, you can turn this using our AI into a simple template where you just fill in the prescriber information, the patient information, and send it off to the prescriber to review and approve an alternative, thus saving you time creating this document and then sending it. Our last example here is what to do if a first-line therapy is unsuccessful and therefore second-line therapy is required, but that second-line therapy also needs to be covered by the provincial formulary. So this example, we're going to use mild acne, patient who's using benzoyl peroxide. It's not effective. What could be the next option? And make sure that it's covered by ODB. And here's the query. Okay, so for mild acne, if the first line therapy of benzoyl peroxide is not working, generally you could try a combination product or you can add on a topical retinoid. So let's see what it said. So I mentioned topical retinoid differin, but also mentions not covered by ODB. It's mentioned a combination product with an ODB that has ODB coverage and a DIN, and it's mentioned a combination product. So let's say we did want to add a retinoid, so I could ask it as a follow-up question, which retinoids are covered acne ODB? Okay, so given a variety of different ones, I should have said maybe topical retinoids because it also gave oral, but it says not covered, partially covered with an LU code, partially covered LU code. Yeah, so let's take a look at this one, Steve A. Yep, it is covered, but the LU code is obviously for treatment of acne. So these answers would be correct. So in summary, these are some of the daily practice problems we're looking to solve with our AI Medication Expert. And ultimately, these daily problems have the same theme. They all steal time from the clinician that could be better spent doing better things such as patient care. These daily problems cause clinicians to lose time because they need to think about what are the therapeutic alternatives, of those alternatives, which of them are covered by insurance. And then afterwards, if you are a pharmacist, you have to prepare the template or documentation to send to the prescriber. At the same time, the prescriber also needs to review and approve this documentation as well. If you have any questions, feel free to reach out to us at aiskyra.health@gmail.com. Thank you.